Using the optional accessories. Using the stretcher adapter bar. The stretcher adapter bar is required to mount MOVES SLC onto a non-folding stretcher. It will mount to the approximate center of the stretcher, serving as a mounting point for the front clamp. To install the stretcher adapter bar, first pull the cam handle open to loosen and remove the separable clamp from the adapter bar. Line up the adapter bar underneath the center of the stretcher and latch the hinged end onto the stretcher pole. With the cam handle open, reattach the clamp to the adapter bar. Close the cam handle once both ends of the adapter bar are snug against the stretcher poles. Mount MOVES SLC onto the stretcher using the adapter bar as the mounting point for the front clamp. Installing the IV pole. The IV pole can be mounted onto the anchor rail on the top of MOVES SLC to hold IV bags or mount other equipment. To install the IV pole, first rotate the knurled clamp sleeve counterclockwise to release the anchoring base. Insert the anchor end of the IV pole into the rail at the top of MOVES SLC and slide it towards the ventilator driving gas inlet until the anchors are in the center position between two circular openings. Rotate the knurled clamp sleeve clockwise to secure the anchor locking base of the IV pole to the MOVES SLC. The IV pole is now secure on the device. Using the reed grab handles. The optional reed grab handles can be attached from the two short anchor rails at either end of MOVES SLC. First, locate the short anchor rails at either end of the device at the top. The anchor studs on the handles are pre-attached. Simply depress the pin in one of the studs and slide it along the rail, then release the pin and ensure it locks into place between two circular openings. Repeat for the second handle. Use the reed grab handles to carry MOVES SLC with both hands or with personnel at either end of the device. Using the remote screen. The remote screen interface displays the same program screens as the local user interface of MOVES SLC, not including the system test screen, offering the convenience of a secondary portable monitor with a larger screen and the ability to control the settings of MOVES SLC. The remote screen comes with a pre-attached connection cable and the charging cord and power adapter. To connect the remote screen to MOVES SLC, locate the auxiliary communication port on MOVES SLC. Lift the rubber cover and align the two slot keys on the remote screen cable connector with the two receiving channels in the auxiliary communication port connection. Then insert the connector. Turn on the remote screen by pressing and holding the power switch at the bottom right until the power indicator light turns on. If the drive status indicator is on, wait until it turns off to press the power switch, disconnect, or connect the charging cord, or touch the tablet buttons and/or screen. If the remote screen is turned on but not connected to MOVES SLC, the Wait for Device screen will show. When the remote screen is connected and MOVES SLC is turned on, the Connecting to Device screen is displayed. The dashboard of the remote screen contains the following information: the battery charge level and wall power connection of the remote screen, the connection state icon, the alarm audio pause or disable button, the administrator tab, the screen brightness slider, and an alarm volume slider. When MOVES SLC is turned on and the operator is completing the startup tests, the remote screen displays the setup screen with the initializing status. Once the MOVES SLC has completed the system tests, the remote screen can be used to operate the device. Navigation on the remote screen is controlled using touch-sensitive buttons, shown at the bottom of the main screen. Press the Non-Invasive Blood Pressure button or Suction button to initialize a non-invasive blood pressure reading or the suction capability. Press the Screen button to move to the next screen in sequence. Press the Cancel button to reject the current value that is being changed and return to the previous value. Press the Check button to change or confirm a changed parameter. The Next and Previous buttons allow you to select next or previous items and increase or decrease a numeric value. You can also select the available buttons on the main screen to change the screen view, view the alarm cue, change the source of heart rate, zero the invasive blood pressure channels, or select a graph. Changing the graphs on the remote screen will not change the graphs on MOVES SLC's display screen, allowing you to view 4 separate graphs. Alarm indicators are displayed on the remote screen via colored status bars on either side of the screen. Charging the remote screen. The battery level display icon on the remote screen will show the percentage charge when it is plugged in and the estimated time remaining if it is running on battery power. Battery status is also indicated to the left of the power switch. Refer to the operator's manual for more information on battery status indicators. To charge the remote screen battery by connecting to wall power, locate the DC connection under a plastic cap in the bottom left corner of the remote screen. Lift the cap and connect the charging cable to the device, then plug the cord into wall power.